I'd like to introduce you to our novel sinus irrigation kit, FLO Sinus Care. FLO Sinus Care is an effective positive pressure method of cleaning the sinus cavities. The sinus cavities are lined with mucus-secreting membranes. The mucus is important because it traps foreign particles, bacteria and viruses and helps the upper respiratory tissues to keep clean and healthy. However, when the mucus drainage points in the sinuses become narrowed or blocked, as they can do in viral infections such as the common cold and flu, hay fever and from other causes, the mucus can no longer escape the sinus cavity. Pressure builds up and this may cause a pressure pain in the facial region. In some patients, mucus blockage can be so severe that surgery is required to relieve it. It is worth noting that after surgery, patients are required to wash their nasal and sinus cavities to get rid of dried mucus, blood clots and bacteria. The ultimate success of an operation depends on good post-operative cleaning. Nasal pump sprays do not provide an adequate amount of fluid to wash and clean the sinus cavities. Similarly, nebulizers and inhalations are inadequate. The best way to achieve an effective wash of the sinuses is to use a positive pressure, high volume washing device such as FLO Sinus Care. Here's how to use FLO Sinus Care. Wash your bottle and components with a mild dishwashing detergent and a paper towel. Use warm water and then rinse well. Reassemble the bottle, dip tube and cap. Your device is now ready for use. Add 1 sachet of FLO Sinus Care to the bottle and fill with cool boiled water. Screw on the cap and dip tube and gently shake until all the FLO Sinus Care granules have dissolved. The next step is to actually use the device to wash out the problematic sinuses. Lean over a basin and put your chin as close to the chest wall as possible. Now start breathing through the mouth and insert the top of the cap snugly into one nostril. Firmly but gently squeeze the bottle until half the contents have been emptied. Then withdraw the bottle from the nostril and allow it to refill with air. Now repeat the procedure in the opposite nostril. Gently blow your nose to get rid of excess fluid. Note, if you have had any nasal or sinus operation, you should only blow your nose if your surgeon has given permission for you to do so. Finally, you need to clean the FLO Sinus Care device. Disassemble the device and rinse all components in running water. You should then thoroughly dry all the components with a clean paper towel. Ensure you reach down into the bottom of the bottle to get this perfectly dry. Shake the dip tube to get as much water out as possible. Remember that bacteria love water, so the drier your device, the less chance of unwanted bacterial contamination. Reassemble the components so that your FLO Sinus Care is ready for the next time you need to use it. Please be sure to read the enclosed patient information leaflet for further information on ongoing cleaning requirements.